All right, diving right in today, folks. We're tackling a topic that you guys specifically requested, extrapulmonary TB in India.
Ooh, interesting.
We've got this training module from the India's National TB Elimination Program, and some really fascinating stats we got to unpack.
Yeah,
So, did you know that TB can actually affect organs beyond just the lungs?
right.
It's called EPTB,
EPPB.
and it's a pretty big deal in India. Accounts for a significant chunk of cases, actually.
Yeah, it's about a third, roughly.
So we're going on a journey. We're going to uncover these diagnostic mysteries, the crazy forms it takes, and the amazing public health battle that India is waging against EPTB.
Absolutely. It's a fascinating area and kind of surprising because when we think of TB, you usually picture coughing, lung issues.
Yeah.
But EPTB flicks the script. It's TB setting up shop in places you wouldn't expect. Lymph nodes, brain, even your bones.
Okay, so not your typical TB scenario then. What makes EPTB such a diagnostic puzzle? Why is it so hard to figure out?
Well, one of the biggest hurdles is that EPTB often flies under the radar of our standard tests.
Ooh.
It's frequently what we call lactobacillary, meaning it has a low bacterial count. So imagine trying to find a tiny needle in a haystack. That's what diagnosing EPTB through a microscope can be like.
Wow.
Doctors have to rely on this combo of clinical judgment, looking at imaging, things like ultrasounds and CT scans, and sometimes even more advanced molecular testing to really nail down the diagnosis.
So it's like a medical detective story. They're piecing together all these clues from different sources.
Precisely. And to make things even more intriguing, EPTB wears many different masks, so to speak.
Masks, huh? I like that. That's a great way to put it. So let's unmask some of these different forms of EPTB. What are we dealing with here?
Well, let's start with the most common form in India, lymphatic TB.
Okay.
Now, you might think, well, lymph nodes, not a big deal, but it's not that simple. The NTEP training module lay out this fascinating 5-stage classification system for how lymph node TB progresses.
Wow.
It starts with subtle swelling and can escalate to accesses and even these tunneling tracts called sinus tracts.
Whoa.
It's crazy.
Stages. So it's like watching a disease unfold in slow motion, except it's happening inside your body.
Exactly, it really is. And doctors use this staging system to guide treatment and predict potential complications. It's remarkable how much we've actually learned about the progression of this disease.
That's incredible. All right, so lymphatic TB is about these battles happening in the lymph node. What other EPTB players are on the field, so to speak?
Another tricky one is pleural TB. This one affects the space around your lungs, the pleura.
Okay.
Normally, there's just a bit of fluid there for smooth breathing, but pleural TB messes things up, causes this excessive fluid buildup, compressing the lungs, making breathing difficult, and you get this sharp gas pain.
Oh, fluid buildup around the lungs. That does not sound pleasant at all.
Not pleasant at all, and the diagnosis can be quite a challenge. While a chest x-ray can show the fluid buildup, doctors often need to do a procedure called thoracentesis.
Say that again?
Thoracentesis, where they actually draw fluid from the pleural space to analyze it. There's a specific test called ADA that's particularly helpful in diagnosing pleural TB, but sometimes they even need to use molecular testing to get a definitive answer.
So it's not just about looking at the lungs themselves, but the space around them, and that requires some pretty specific tests.
Yeah.
Are we done with the chest, or are there more EPTB surprises lurking in there?
We could move away from the chest for now, but get ready for this. EPTB can wreak havoc in your abdomen.
Abdominal TB. Okay, now we're talking about a whole different set of organs.
Exactly. And what's so challenging about abdominal TB is that it can affect so many different organs within the abdomen.
Oh, wow.
The peritoneum, the intestines, the liver, spleen, even the reproductive organs in women.
Wow, talk about a wide playing field.
It really is. And the symptoms can be incredibly vague: abdominal pain, weight loss, changes in bowel habits. It can be easily mistaken for other conditions like irritable bowel syndrome or even Crohn's disease.
So how do doctors even begin to unravel this abdominal mystery? I mean, are we talking about more detective work?
Absolutely. Doctors have to become master sleuths, using a bunch of tools to figure out what's going on. They'll start by asking detailed questions about the patient's symptoms and medical history.
Okay.
Then they'll do a physical exam, feeling for any abnormalities in the abdomen.
So they're listening to the patient's story, using their hands to gather clues. What comes next in this medical investigation?
Next up are blood tests and imaging studies. Blood tests can reveal things like signs of inflammation or anemia, while imaging studies like ultrasound, CT scans, or MRIs can give us a visual roadmap of what's happening inside the abdomen.
Oh, cool.
They can show if organs are enlarged, if there's fluid buildup, or if any masses are present.
It sounds like doctors have to use all their senses and technology to get to the bottom of abdominal TB.
They really do. And even then, sometimes they need to go a step further and actually obtain tissue or fluid samples from the abdomen,
Oh, wow.
either through a biopsy or a procedure called laparoscopy.
Ah, so getting those samples to examine under the microscope and test for TB bacteria, classic detective work.
Precisely. And that brings us to another EPTB, heavyweight CNS TB, or central nervous system TB.
CNS TB. Okay, now we're talking brain and spinal cord. This sounds serious.
Absolutely it is. CNS TB is one of the most severe forms of EPTB because it can lead to life-altering consequences.
Oh, no.
Think about it, TB bacteria invading the command center of your body,
Right.
the brain and spinal cord. It can cause inflammation of the meninges, those protective membranes surrounding the brain and spinal cord, leading to meningitis.
Meningitis. That's a word that sends chills down my spine.
Yeah, it's definitely a serious condition, and the symptoms can be incredibly varied, and they often develop gradually, so they're really easy to miss in the early stages.
So we're talking headaches, fevers, maybe even changes in behavior.
Exactly. Patients might experience headaches that get worse over time, low-grade fevers, neck stiffness, confusion, drowsiness, even seizures.
Wow.
It's a whole spectrum of neurological symptoms.
So with all this variability in symptoms, how do doctors even begin to diagnose CNS TB?
Again, it starts with a detailed medical history and a really thorough neurological exam,
Okay.
where doctors assess things like mental status, reflexes, coordination, and sensory function. But the gold standard for diagnosing CNS TB is a procedure called a lumbar puncture,
Ooh, a lumbar puncture.
also known as a spinal tap.
Spinal tap. Sounds a bit intimidating. What exactly is involved in that?
It involves inserting a needle into the lower back to collect a sample of cerebrospinal fluid, the fluid that bathes the brain and spinal cord.
Right.
And then this fluid is analyzed for various markers of infection, including cell counts, protein and glucose levels, and of course the presence of TB bacteria.
So it's like a liquid biopsy of the central nervous system, providing crucial clues about what's going on.
Precisely. And in addition to the lumbar puncture, doctors might order imaging studies, things like CT scans or MRI scans, to visualize the brain and spinal cord,
Makes sense.
looking for any signs of inflammation, swelling, or abscesses.
Wow, it's like piecing together a complex puzzle with each test revealing a new piece of information. And it seems like there's a lot of overlap in how doctors approach diagnosing these different types of EPTB.
You're absolutely right. There's a common thread of careful history-taking, physical examination, blood tests, imaging studies, and sometimes even tissue or fluid sampling to get a definitive diagnosis.
So a multi-pronged approach using all the tools in the medical toolbox to uncover the secrets of EPTB.
Exactly.
Well, we've covered a lot of ground already, from lymphatic TB to CNS TB. But before we jump into treatment and India's incredible efforts to combat this disease, there's one more EPTB form we need to discuss, skeletal TB.
Ah, yes, skeletal TB, the one that targets our very framework, our bones and joints.
Bones and joints. Yikes. I imagine that could be incredibly painful.
It can be, and debilitating too. See, skeletal TB most commonly affects the spine,
Okay.
but it can also involve other bones and joints throughout the body.
The spine, the backbone of our body, literally. So we're talking about potential damage to the very structure that holds us upright.
Exactly. And it all starts with TB bacteria reaching the bone and triggering an inflammatory response.
Got it.
This can lead to bone destruction, weakening of the bone, and even the formation of abscesses within the bone.
Accesses within the bone, that sounds incredibly painful.
It can be excruciating. And when skeletal TD affects the joints, it can cause pain, swelling, stiffness, and limited range of motion.
So we're talking about a real assault on the musculoskeletal system. What are some of the red flags that might make someone suspect skeletal TB?
The most common symptom is persistent pain,
Okay.
often described as a deep, dull ache that gets worse with movement or pressure. There might also be swelling around the affected area, stiffness in the joints, and difficulty moving the affected limb or body part.
So it's a combination of pain, inflammation, and limited mobility. How do doctors go about diagnosing skeletal TB? I imagine it involves some of those familiar strips we've discussed before.
You're exactly right. It starts with taking a detailed medical history, asking about the patient's symptoms, when they started, and any potential risk factors for TB,
Right.
like a history of exposure to the disease. Then comes the physical exam, where doctors assess the affected area for pain, swelling, tenderness, and range of motion.
So they're listening to the patient's story, using their hands to gather information. What about blood tests and imaging? Are those part of the diagnostic puzzle as well?
Absolutely. Blood tests can reveal signs of inflammation, but imaging studies are crucial for actually visualizing the affected bones and joints. X-rays are often the first step. They can show bone abnormalities and joint damage.
X-rays, the classic tool for peeking inside the body.
Exactly, but sometimes X-rays aren't enough to catch those subtle signs of early skeletal TB. In those cases, doctors might order more sophisticated imaging studies like CT scans or MRI scans.
Ah, so they're escalating the investigation with more powerful imaging tools.
Precisely. CT scans provide a three-dimensional view of the bones, letting doctors assess the extent of damage and look for abscesses. MRI scans are particularly useful for visualizing the soft tissues around the bones and joints.
Okay.
The cartilage, ligaments, and tendons.
So CT scans for the bony details and MRI scans for the soft tissue insights.
Exactly. And sometimes, even with these advanced imaging techniques, doctors might need to obtain tissue or fluid samples from the affected area to confirm the diagnosis definitively.
So back to those microscopic clues and lab tests for TB bacteria, it seems like there's this recurring theme of needing those microscopic confirmations.
You've hit the nail on the head. Skeletal TB, like many other forms of EPTB, often requires a combination of clinical judgment, imaging studies, and laboratory tests to arrive at a definitive diagnosis.
It's fascinating how doctors have to weave together information from all these different sources to solve these medical mysteries.
It really is, and once the diagnosis is made, the treatment journey for skeletal TB can be quite challenging.
Challenging in what way?
Well, it typically involves a prolonged course of anti-tuberculosis medications,
Okay.
often for 6 months or even longer.
6 months? Wow.
And in some cases, surgery might even be necessary to repair or replace damaged bones or joints.
Surgery that adds another layer of complexity to an already difficult situation.
It does, and it highlights the importance of early diagnosis and treatment to minimize the risk of complications.
Well, we've covered a lot of ground in this deep dive into EPTB in India, exploring 5 distinct forms: lymphatic TB, pleural TB, abdominal TB, CNS TB, and skeletal TB.
Quite a range.
We've seen how these diverse forms can affect virtually any organ in the body,
Yeah.
often mimicking other conditions and posing, significant diagnostic challenges.
It's a reminder that TB is a master of disguise, capable of lurking in unexpected places and presenting in ways that can easily be missed.
Exactly. And that brings us to our next chapter in this deep dive unveiling India's remarkable fight against EPTB.
Okay?
We'll explore their ambitious national program, their commitment to providing free diagnosis and treatment, and those innovative strategies they're using to tackle this complex public health challenge.
It's a story of determination, innovation, and hope.
Stay tuned as we delve into the next chapter of the deep dive.
India's fight against EPTB, it's truly inspiring. They've launched this ambitious national strategic plan, for TB elimination, running all the way from 2017 to 2025.
Ambitious is an understatement. It sounds like they've really set their sights on eliminating TB entirely. What's the game plan for something that big, that huge of an undertaking?
The plan, it's built on 4 pillars: prevent, detect, treat, and build.
Okay.
Each pillar focuses on a different aspect of TB control, and together they form like this comprehensive strategy for tackling the disease.
Okay, 4 pillars. That sounds like a solid foundation to build upon. Can you break down what each pillar kind of entails, especially in the context of EPTB?
Of course, yeah. The prevent pillar, that's all about stopping TB in its tracks, like before it even gets a chance to take home.
Okay.
So one key strategy there is expanding TB preventative treatment, giving it to those in close contact with someone who has pulmonary TB.
Right.
Think of it as like creating a protective shield around those most vulnerable to infection.
I see. So it's about like proactive intervention, preventing TB from spreading in the first place.
Exactly. And they're not stopping there. The program, it's actively engaging with researchers and manufacturers, to develop newer, more effective vaccines.
Cool.
They're even trialing a new skin test that could revolutionize how we diagnose TB infection.
It's incredible to see like that kind of forward-thinking approach, investing in research and development to stay ahead of the curve.
Yeah.
What about the detect pillar? How are they finding these kind of hidden cases of EPTB, especially those that might be, mistaken for something else?
Yeah, that's where things get really interesting. The detect pillar is all about, casting this wide net and actively searching for cases.
Okay.
Both drug-susceptible and drug-resistant TB. They're going beyond that traditional passive case finding and really reaching out to high-risk populations, like those living with HIV or those in crowded settings like prisons.
Yeah.
They're also working to improve that collaboration with private healthcare providers, encouraging them to notify cases and refer patients to the national program for treatment.
So it's about breaking down these silos and creating a more integrated approach to TB detection. It sounds like they're leaving no stone unturned.
Exactly. And the best part, the program, it provides free diagnostic tests and treatment for all forms of TB, including ETTB.
Free diagnosis and treatment, that's a game changer. It removes like a huge barrier to accessing care, especially for those, who might be struggling financially.
It truly is. And there's more. The program also offers nutritional support to patients through a scheme called the Nishai Poshan Yojana.
Okay.
This scheme, it provides financial assistance to TB patients, to ensure they have access to nutritious food during their treatment,
Yeah.
recognizing that, good nutrition is essential for recovery.
So it's not just about like treating the disease, but supporting like the whole person throughout their TB journey. What about the build pillar?
Yeah.
How are they strengthening the healthcare system to effectively manage EPTB?
So the build pillar that focuses on building a robust healthcare infrastructure, for TB control. This involves everything from strengthening laboratory capacity and improving surveillance systems
Wow.
to training healthcare workers and raising public awareness about TB, right? They're investing in technology, improving data collection and analysis, and really streamlining treatment protocols.
So it's about creating like a sustainable system that can effectively prevent, detect, and treat TB in the long term. So India is tackling EPTB from all angles: prevention, detection, treatment, and system strengthening. It's really impressive. Now let's maybe shift gears a little bit and delve into the specific challenges of treating EPTB. We know that early diagnosis is key, but what does the treatment journey typically look like for someone diagnosed with EPTB?
Well, the cornerstone of ATTB treatment, just like with pulmonary TB, is anti-tuberculosis therapy,
Okay.
or ATT. It involves taking this combination of antibiotics, typically given for at least 6 months.
6 months of antibiotics. That's a pretty big commitment.
It is.
Are there any challenges in ensuring people complete the full course of treatment?
There can be, yeah. Some people might experience side effects from the medications,
Yeah.
while others might struggle with the social and economic burdens of prolonged treatment, like missing work or facing stigma. That's why patient support is so crucial, throughout that treatment journey.
So it's about more than just handing someone a prescription. It's about providing that holistic care and addressing the various challenges that patients might face. What specific like measures does India's program take to support patients?
They offer a range of support services. Things like transportation assistance to help patients get to their appointments, counseling, and education to make sure they understand their treatment regimen and the importance of adherence, and even, financial incentives to encourage private providers to notify cases and collaborate with the national program.
It's remarkable how much thought and care has gone into creating this comprehensive program.
Yeah.
It really underscores their commitment to eliminating TB. Now, let's zoom in on some specific types of EPTB and explore the unique challenges that they pose. We talked about how lymphatic TB involves this fascinating like 5-stage progression. Can you elaborate on that a little bit more?
Absolutely, yeah. The NTEP training module actually describes these 5 stages in great detail, highlighting the different clinical presentations and potential complications.
So it's not just a matter of like having swollen lymph nodes. There's like a whole spectrum of severity.
Precisely, yeah. In the early stages, the lymph nodes, they might just be, slightly enlarged and painless, but as the infection progresses, they can become larger, more tender, and even matted together.
Matted together, what does that mean?
It means they kind of get stuck to each other, forming a clump.
Oh, wow.
And then in some cases, they can even, adhere to the overlying skin, causing redness, warmth, and eventually the formation of these draining tracts.
Right.
Called sinus tracts.
Sinus tract. That sounds pretty intense.
It can be, especially if the infection, spreads beyond the lymph nodes and into those surrounding tissues.
So the staging system helps doctors kind of gauge the severity of the infection and guide those treatment decisions. What are some of the key factors that determine which stage a patient's in?
Doctors, they consider a whole range of factors, things like the size and number of affected lymph nodes, whether they're, tender or matted, whether there are any skin changes, and whether the infection has spread to other areas.
So it sounds like a pretty meticulous assessment taking into account all those clinical clues.
It really is. And the treatment approach, it can vary, depending on the stage of the disease.
Okay.
In the early stages, when the infection is limited to the lymph nodes, medication alone, that might be enough.
Okay.
But in more advanced stages, when there are complications like abscesses or sinus tracts,
Yeah.
surgery might be necessary to drain the infection and remove that damaged tissue.
Surgery. That's a reminder of the potential seriousness of EPTB, even in a seemingly like lesser form, like lymphatic TB.
Exactly, exactly. It underscores the importance of early diagnosis and treatment to prevent those complications from developing.
Well, let's move on to another form of EPTB that we discussed earlier, pleural TB, the one that affects the space around the lungs. You mentioned a test called ADA that's helpful in diagnosing this type. Can you tell us a little bit more about that test and why it's so important?
Yeah, of course. The ADA test, which stands for adenosine deaminase,
Okay.
it's a blood test that measures the levels of an enzyme called adenosine deaminase. This enzyme is actually involved in the immune response, and its levels tend to be elevated in pleural fluid when TB is present.
So it's like a signal flare, alerting doctors to the possibility of TB infection.
Exactly, exactly. The ADA test has high sensitivity and specificity for pleural TB, meaning it's really good at correctly identifying both those who have the disease and those who don't.
So it helps to rule out, other conditions that might be causing similar symptoms.
Precisely. It's a valuable tool in the diagnostic toolbox, especially in a country like India where, TB is prevalent and other conditions like lung cancer or pneumonia, they might present with similar symptoms.
Right.
So it's really helpful to have that.
It sounds like a crucial piece of the puzzle, helping doctors make an accurate diagnosis and initiate that appropriate treatment.
It is, and in addition to the ADA test, doctors might use other tests to confirm the diagnosis, including analyzing that pleural fluid for cell counts, protein levels, and the presence of TB bacteria.
So it's like a multifaceted approach, using a combination of tests to kind of get that clear picture.
Exactly, exactly. And once the diagnosis is made, the treatment typically involves a course of anti-tuberculosis medications, often for 6 months or longer.
6 months. Again, that kind of underscores the need for patient support and education, right? To make sure people adhere to that treatment regimen.
Absolutely. It's crucial to emphasize the importance of completing that full course of treatment, to really eradicate the infection and prevent the development of drug resistance.
Well, let's move on to another form of EPTB that we discussed earlier, abdominal TB. You mentioned that it can affect a wide range of organs in the abdomen and often presents with kind of vague symptoms. Can you give us some specific examples of how abdominal TB might manifest?
Sure. One of the most common presentations is abdominal pain,
Okay.
which can range from, mild to severe and be localized to a specific area or diffuse throughout the abdomen. Patients, they might also experience weight loss, fever, loss of appetite, and changes in bowel habits like diarrhea or constipation.
So it's like a real mixed bag of symptoms that could easily be mistaken for other conditions.
Exactly. And that's why it's so important for doctors to have a high index of suspicion for abdominal TB, especially in patients who have risk factors for the disease, like a history of exposure to TB or a weakened immune system.
So doctors need to be thinking about TB even when the symptoms seem, common or nonspecific.
Exactly, exactly. And to help, differentiate abdominal TB from other conditions, they'll also order imaging studies,
Okay.
things like ultrasound, CT scans, or MRIs. These studies can help visualize the abdominal organs and look for signs of TB,
Okay.
like enlarged lymph nodes, fluid buildup in the abdomen, or thickening of the intestinal walls.
So imaging plays a crucial role in that diagnostic process, but you also mentioned that sometimes doctors need to go a step further and actually obtain tissue or fluid samples from the abdomen. Why is that necessary?
Yeah, so while imaging, can provide strong clues, obtaining tissue or fluid samples allows doctors to actually examine them under a microscope and perform laboratory tests to confirm the presence of TB bacteria.
Right.
And this definitive diagnosis helps guide treatment decisions and ensures patients receive the most appropriate care.
So it's about getting those microscopic confirmations to tailor the treatment effectively.
Precisely. And the procedures used to obtain those samples, they can vary depending on the suspected location of the infection. One common procedure is laparoscopy,
Okay.
which involves inserting a thin telescope-like instrument through a small incision in the abdomen to visualize the organs and collect biopsies. Another procedure is fine needle aspiration,
Okay.
which involves using a needle to withdraw fluid or cells from a specific area, such as an enlarged lymph node.
It sounds like a delicate and intricate process requiring, specialized skills and equipment.
It is, and it highlights the importance of, having well-trained healthcare providers and access to that advanced medical technology, particularly in areas where, TB is prevalent.
Well, we've covered three forms of EPTB in more detail: lymphatic TB, pleural TB, and abdominal TB. Let's now shift our focus to CNS TB, the one that affects the brain and spinal cord. You mentioned earlier that it's one of the most severe forms of EPTB, capable of causing, life-altering consequences. Can you elaborate on that and explain why CNS TB is so dangerous?
Sure. CNS TB is particularly dangerous because it affects the central nervous system, which, controls virtually every aspect of our body's function.
Right.
When TB bacteria invade the brain and spinal cord, they can cause inflammation, damage to tissues, and interfere with the transmission of nerve signals. And this can lead to a wide range of neurological problems,
Yeah.
depending on the specific areas affected.
So it's like a disruption of the body's command center, potentially affecting everything from movement and sensation to thinking and behavior.
Exactly, exactly. And the consequences, they can be devastating, ranging from, persistent headaches and cognitive impairments to seizures, paralysis, and even death.
It's a stark reminder of the seriousness of TB and the importance of early diagnosis and treatment. You mentioned earlier that a procedure called a lumbar puncture or a spinal tap is the gold standard for diagnosing CNS TB. Can you walk us through that procedure and explain why it's so crucial?
So a lumbar puncture that involved inserting a needle between two vertebrae in the lower back
Okay.
to collect a sample of cerebrospinal fluid, the fluid that surrounds and protects the brain and spinal cord.
Right.
This fluid, it acts as a cushion and also helps to transport nutrients and remove waste products from the central nervous system.
So it's like tapping into the lifeblood of the central nervous system.
A good way to put it, by analyzing the cerebrospinal fluid, doctors can look for, those telltale signs of TB infection, including the presence of TB bacteria, specific immune cells, and changes in the fluid's chemical composition.
So it's about looking for those microscopic fingerprints of TB, within the central nervous system.
Exactly. And a lumbar puncture, it's a relatively safe procedure, but it does carry some risks, like, headaches or bleeding. That's why it's typically performed by a specialist in a hospital setting.
It sounds like a delicate and precise procedure requiring a skilled hand and a keen eye.
It is, and the information gleaned from a lumbar puncture, it can be invaluable, in confirming a diagnosis of CNS TB and guiding treatment decisions.
Well, we've covered four major forms of EPTB in details: lymphatic TB, pleural TB, abdominal TB, and CNS TB. Let's wrap up this section by discussing skeletal TB, the one that targets our bones and joints. You mentioned that it most commonly affects the spine, but can also involve other bones. Can you tell us a little bit more about how skeletal TB affects the spine and what makes it so debilitating?
Sure. So when UTB bacteria reach the spine, they often target the vertebrae, those bony building blocks that make up the spinal column.
Okay.
And the infection can cause inflammation and destruction of the vertebrae, leading to pain, stiffness, and difficulty moving the back.
So it's not just a matter of like back pain. It's about potential damage to the very structure that supports our body.
Exactly, exactly. And as the infection progresses, it can lead to weakening of the vertebrae,
Yeah.
making them more susceptible to fractures.
Fractures in the spine, that sounds incredibly dangerous.
It can be, especially if the fracture compresses the spinal cord, that bundle of nerves that runs through the spinal canal.
So spinal cord compression, now we're talking about potential paralysis.
Unfortunately, yes. Yes, spinal cord compression, it can lead to a range of neurological problems, including, weakness, numbness, tingling, and even paralysis in the arms or legs.
So skeletal TB, particularly when it affects the spine, can have far-reaching consequences beyond just bone pain.
It's a reminder that TB, it can affect multiple organ systems and lead to a cascade of of complications if left untreated.
Well, we've covered a lot of ground in this deep dive into EPTB in India, exploring, 5 distinct forms and their unique challenges. We've also delved into India's, impressive efforts to combat this disease with their comprehensive national program, focused on prevention, detection, treatment, and system strengthening.
It's a story of resilience, innovation, and a deep commitment to improving public health.
Before we wrap up, I'd like to circle back to something you mentioned earlier, the importance of raising awareness about EPTB,
Yeah.
both among healthcare providers and the general public. Why is awareness so crucial in the fight against EPTB?
Awareness is key because EPTB, it often presents with these vague and nonspecific symptoms,
Right.
making it, really easy to miss or misdiagnose, especially in those early stages.
So it's about recognizing that TB isn't just, a cough and a chest X-ray. It can manifest in many different ways.
Exactly. And the more people, know about the diverse presentations of EPTB, the more likely they are to actually seek medical attention promptly if they experience any unusual or persistent symptoms.
Early detection is crucial for preventing complications and ensuring the best possible outcome.
Absolutely. And raising awareness, it isn't just about educating the public. It's also about empowering healthcare providers with the knowledge and tools to recognize and diagnose EPTB early on.
So it's about equipping both patients and doctors with the information they need to fight this disease effectively.
Precisely. And the more we can do to raise awareness and improve early detection,
Yeah.
the closer we'll get to achieving the goal of a TB-free world.
Well, thank you for sharing your expertise and insights with us today. I feel like I've gained a much deeper understanding of the complexities of EPTB and the remarkable efforts being made to combat it in India.
Well, it's been my pleasure to join you on this deep dive.
And to our listeners, thank you for tuning in and joining us on this journey of discovery. We hope you've learned something new and are inspired to learn more about this often hidden form of TB.
Yes.
Remember, knowledge is power, and together we can make a difference in the fight against TB. We've covered a lot of ground in our deep dive into extrapulmonary TB in India.
We have.
All the forms it takes, those diagnostic challenges, and India's amazing efforts to fight this disease. But before we wrap things up, I wanted to touch on one more form of EPTB that we haven't really gotten into yet. Genitourinary TB.
Yes, genitourinary TB, the one that often flies under the radar. It's a form of TB that affects those organs of the urinary and reproductive systems.
So we're talking kidneys, bladder, reproductive organs, like a whole different set of systems that TB can disrupt.
Exactly. And what makes genitourinary TB so challenging is that it can be very subtle, especially in those early stages, and it can mimic other more common conditions.
Like what?
Things like urinary tract infections or even some sexually transmitted infections.
So it's another case of TB masquerading as something else,
Right.
which could potentially delay diagnosis and treatment.
Precisely. And the consequences of delayed diagnosis can be really significant.
How so?
Well, it can lead to scarring and damage to those affected organs, which can then go on to impact, both urinary function and fertility.
Wow, that's a serious concern, especially considering, that potential long-term impact on people's lives. What are some of the red flags that might make someone suspect genitourinary TB? Like, how would they even know?
The symptoms, they can be quite varied. It really depends on which organs are affected.
Okay.
Some people, they might experience, urinary symptoms like frequent urination, painful urination, or blood in the urine. Others might have, genital symptoms like pain, swelling, or discharge. And still others might have more general symptoms like fever, fatigue, or even weight loss.
So it really is, again, that mixed bag of symptoms that could be mistaken for a whole host of other things.
Exactly, and that's why it's so crucial for doctors to really have a high index of suspicion for genitourinary TB, especially in patients who already have those risk factors for TB, like a history of exposure to the disease or weakened immune system.
So doctors need to be thinking about TB even when the symptoms seem pretty common or non-specific.
Absolutely. And it's to really help differentiate genitourinary TB from other conditions, they'll use a combination of tests.
Like what?
Well, things like urine tests, imaging studies, and sometimes even biopsies.
So let's break those down a bit. What are some of the key urine tests used to diagnose genitourinary TB?
One of the most important ones is a microscopic examination of the urine,
Okay.
where lab technicians are actually looking for the presence of TB bacteria under a microscope. They might also try to grow the bacteria from the urine sample in a lab, a process called culture. And increasingly, they're using molecular tests like NAT-AT to detect TB DNA in the urine, which can give them a faster and more accurate diagnosis.
So it's a combination of like visual identification, growing the bacteria, and analyzing its DNA. What about imaging studies? What role do they play in diagnosing genitourinary TB?
Imaging studies like ultrasound, CT scans, and MRI scans, they can help visualize the kidneys, the bladder, and the reproductive organs. Looking for any signs of TB involvement,
Okay.
they can show if organs are enlarged, if there are any masses or blockages, or if there's any fluid buildup.
So imaging provides that visual roadmap of what's happening, inside the urinary and reproductive systems.
Exactly. And in some cases, doctors might actually need to perform a biopsy, taking a small tissue sample from that affected organ to examine under a microscope and confirm the presence of TB bacteria.
So back to those microscopic clues to really nail down the diagnosis. It seems like a recurring theme in diagnosing EPTB, no matter what form it takes.
You're absolutely right, yeah. Whether it's, lymphatic TB, pleural TB, abdominal TB, CNS TB, skeletal TB, or genitourinary TB, confirming the presence of TB bacteria in those affected tissues or fluids is often the gold standard for diagnosis.
It really is remarkable how those tiny bacteria can cause such diverse and widespread problems throughout the body.
It truly is. It highlights the importance of having that comprehensive understanding of TB and all of its many different manifestations, both for healthcare providers and just the general public.
Well, this has been a truly insightful deep dive into extrapulmonary TB in India. We've explored its hidden forms, uncovered its diagnostic secrets, and witnessed India's unwavering commitment to eliminating this disease.
It's been a journey through the complexities of TB, revealing both its challenges and that remarkable progress that's being made.
And to our listeners, thank you for joining us on this deep dive. We hope you've gained a newfound appreciation for the intricate world of extrapulmonary TB and are inspired to learn more. Remember, knowledge is power, and the more we understand about TB, the better equipped we are to fight this global health challenge. Until next time, stay curious, keep exploring, and keep diving deep.